Hi guys, welcome back to my channel. So in this video, I'm gonna talk about like having virtual reality or sims or simulations when it comes to like being comfortable in clinical setting. Um, yes, in my school we do have that option, right? So aside from doing like the regular clinicals at the hospital or a healthcare facility, like we do also like simulations like virtual reality, like all those high tech equipments, right? With your uh, with the headset and all of that, which you can actually use like to like deal with a patient and then kind of like do your interventions and actually like care for the patient. So it's kind of awesome. I think it helps though, because some people like, and I'm not sure if like, because I'm not sure if most of the schools, like have it, or some schools may not have the resource or technology to actually like being able to offer that option, right? But it's really good because sometimes in if you're a nursing student in a hospital, right? So based on my experience, again, I'm just saying, based on experience and like my point of view, as everybody has a different point of view, and then like what do you call this, like comfort level when it comes to like patient care. Because some of my classmates in school, in nursing school, um, they already have like prior healthcare experience. So some of them might be working as a CNA or PCT, patient care tech, for a while prior to getting accepted to nursing school. So their comfort level when it comes to like taking care of a patient or person is above like a normal person or a newbie, so called, when it comes to like dealing with a patient. Because for me, I have prior engineering experience on my previous job, so I'm still trying to like, now I'm getting better, because like I've been doing clinicals for a bit now, for a year. So it's not like when I go to like a unit, like I don't know what to do, like so of course I can have an overview of what to expect when you go to the unit. When you get assigned a patient, you get like a report of what's going on. Then you um, go to the room, do your introduction, again, assessments and all of that, and then by knowing that, you started to like build your own plan of care, like what's your, and then priorities also, like example, like based on how many patients you get assigned, like who are you gonna be seeing first, because again you have to understand like what patient would actually take most of your time and who actually needs um, the most intervention, because some patients are critical, like they have a specific medication that they need to get like in a timely manner. Because like, I mean, in nursing school they teach you like, hey, if you're giving this medication, you can give it like an hour before or an hour after. It depends on the duration of the medication, if it's daily medication or every 4 hours. Again, there's a specific requirement. But when it comes, again, going back to, I get off topic a bit, but going back to virtual reality, right? So uh, yeah, in my school it was cool because at first you get like kind of anxiety because when you're not used to like using the virtual reality equipment, like you're gonna be like paranoid. "Oh, how do I do this?" Because again, like you only have your headset. It's like playing a game, and like if you're buying like a virtual reality set, like because like I used one before when I was like playing a game, uh, but it was owned by somebody else, But actually, I feel like you're actually uh, in the setting, in the world that you're actually uh, playing. But when it comes to this in healthcare or nursing, you're gonna be in the patient's room, and then you kind of simulate like what to expect for you from uh, again, knowing what's going on with the patient. And then the good thing about like the virtual reality compared to the actual clinical setting, right? That if you make a mistake, you're not gonna be scared of harming a actual person or upsetting them, right? So because in virtual reality, if you make a mistake, that's fine. Nobody's gonna get injured or killed. And then after you complete the the virtual reality scenario, you get feedback on how you perform. So the thing about that because like they don't really give you feedback if you're doing correctly or not until you finish everything. So um, once you get your feedback, then if you reattempt and do the same thing, then you should be able to correct whatever mistakes that you did, and kind of like hopefully in the next attempt that you be able to get it right. And then with that experience, it boosts your confidence, because like if you're doing it in a sim, then it gives you an idea of what needs to be done, right? So when you go to the actual setting, at least like, hey, this is what I do based on this. Again, you have to personalize the approach, because the virtual reality is not going to be the actual direct similar to whatever gonna be at the hospital, but it would be in similar in concept. And once you build that, and then again more experience, because again uh, nurses, based on Benner's theory, right, that until 2 years you're still a novice nurse, and after that you get more proficient in becoming expert. Because even that, based on that theory, that if someone has been, example, in a pediatrics unit for 8 years, and then they get reassigned to a different unit, example in cardiac unit or med surg or ICU, then they go back to like the bottom of the ladder, like being a novice again. Because again, whatever routine you get used to, like when you were in pediatrics, will not be the same as in other units. Like of course, like the same concepts, like like how to document it, like patient. It might be similar, but the way you approach patients would be somewhat not the same. Yeah. So cool. I'm just like I just want to make this video because we're gonna start having virtual reality again, and it's kind of awesome. And so again, like I just like in my head that we should not be trying to like aim to be perfect all the time. Again, we need to accept that we can make mistakes. As long as we know, or we accept the fact that we make mistakes, but and we learn from it, and that's more important than trying to be perfect all the time. Because again, like if you have that mentality of um, getting it all right all the time, it's just like too much. And then in the world, it's not gonna be like very feasible, because like that's gonna give you more risk or becoming depressed if you make mistakes, or if you're in the hospital, and no matter how good you are, if a certain patient or or a family member or coworker doesn't like what you're doing, then it's really like pointless sometimes. But again, yeah. All right, guys. Thank you guys for watching.